Hello guys, it is me back with another video on FMGE question, and today I am going to discuss the anatomy of a lower limb. So let's begin. As always, we have a question. Third and fourth lumbricals, lateral two lumbricals of foot are supplied by which nerve? Medial plantar nerve, lateral plantar nerve, peroneal nerve, or none of the above? So pause and try to answer this question. So, guys, we first need to understand what is the nerve supply of the lower limb. So, the nerve supply of the lower limb is given by the lumbar and sacral plexus. Actually, femoral nerve and this obturator nerve, these two nerves are the major nerves which supply the anterior and the middle compartment of the thigh, respectively. Femoral nerve arises from L2, L3, L4 spinal roots, anterior rami of the L2, L3, L4. Obturator nerve arises from the L2, L3, L4, but from the anterior division from the lumbar plexus, and it supplies the middle aspect of the thigh. Okay, so as you can see in this diagram, this is the femoral nerve, which is shown in the green color, and this is the obturator nerve, which is shown in the yellow color. Okay, now sacral plexus, gluteal nerves, superior and inferior gluteal nerve supply the back of the butt. These include the gluteus medius, minimus, and tensor fascia, which are supplied by the superior gluteal nerve, and gluteus maximus is supplied by the inferior gluteal nerve. Now, sciatic nerve. This is the longest nerve in the body, and the origin of the sciatic nerve is from L4, 5, and S1, S2, and S3. And at the p- popliteal fossa, the sciatic nerve, it bifurcates into the common peroneal nerve and the tibial nerve. So now let us discuss each nerve separately. So the first nerve which we are going to discuss is the femoral nerve. Now we know that the femoral nerve arises from the lumbar plexus at the L2, L3, and L4 roots ventral rami of the spinal cord. Okay. Now motor functions of the femoral nerve. So it innervates the anterior thigh muscles that flex the hip joint, which include the pectineus, iliacus, and the sartorius, and extend the knee, quadriceps femoris, which include the rectus femoris, vastus lateralis, vastus medialis, and the vastus intermedius. Okay, so these all muscles are the muscles which comprise the anterior compartment of the thigh. Okay, fine. Now, sensory function. So, sensory function of the femoral nerve includes the cutaneous branches to the anteromedial and anterior cutaneous branches of the femoral nerve, and medial side of the leg and foot, uh, which are through the saphenous nerve. Okay, so motor function, it innervates the anterior compartment of the thigh, and sensory function, all the muscles of the anterior compartment of the thigh, and sensory function, it innervates the anteromedial thigh and medial side of the leg and the foot via the saphenous nerve. Okay, now obturator nerve. So the obturator nerve is also the branch of the lumbar plexus. It also originates from the L2, L3, and L4 ventral rami of the spinal roots, and it also has motor and sensory functions as all nerves do. So motor functions, it innervates the muscles of the middle compartment of the thigh. These muscles include the obturator externus, adductor longus, adductor brevis, and adductor magnus and gracilis. Okay. Now these all muscles are the middle compartment of the thigh. Okay. So please remember them. Okay. Now the sensory functions. So sensory functions include the cutaneous branches of the obturator nerve, innervate the skin of the middle thigh. Okay. And what did we discuss about the femoral nerve? We discussed that that the femoral nerve it has two branches, anterior cutaneous nerve and the saphenous nerve. Okay, anterior cutaneous nerve it innervates the anterior compartment of the thigh cutaneously. Okay, and the saphenous nerve it it gives innervation to the leg and foot. Okay, now is sciatic nerve. So the sciatic nerve, it origin the origin of of the sciatic nerve is from the L4, L5, S1, S2, S3 spinal roots. Okay, and as all nerves do, this nerve also has motor and sensory functions. Now, coming coming to the motor functions, it innervates the muscles of the posterior compartment of thigh, which includes the biceps femoris, semi-membranous and semi-tendinous, and the hamstring portion of the adductor magnus, remaining portion of which is supplied by the obturator nerve. Okay, so only the hamstring part of the adductor magnus muscle is supplied by the sciatic nerve. Rest all part is supplied by the obturator nerve. Okay, now sensory functions. So the sensory function, there are no there are no direct sensory functions of of the sciatic nerve, but the skin of the lateral leg, heel, and both the dorsal and plantar surface of foot are supplied indirectly by by the sciatic nerve via the tibial nerve and the common peroneal nerve. Okay, now let us talk about the tibial nerve. So the tibial nerve, it is also one of the branch of the sciatic nerve. Sciatic nerve, it bifurcates into the two nerves, tibial nerve and the common peroneal nerve at the popliteal fossa. As you can see in this diagram, this is the sciatic nerve. Okay, and it bifurcates into the tibial nerve and the common peroneal nerve. Okay. Now tibial nerve, as it goes down and down, it gives out the some of the branches. Okay, like sensory and the motor branches. Sensory branches innervate the skin of the posterior lateral leg, lateral foot, and the sole of the foot. Okay, and motor, it innervates the posterior compartment of the leg and the majority of the intrinsic foot muscles. Okay, and yeah, and it also has it also has two branches, medial plantar nerve and the lateral plantar nerve. Okay, and the medial plantar nerve, it innervates the it, it it innervates the only one of the lumbricals, only lumbrical which is close to the thumb or the big toe. Okay, and the remaining three lumbricals, these are supplied by the lateral plantar nerve. Okay, now common fibular nerve or the common peroneal nerve. Okay, so the nerve root of the common fibular nerve are same as that of of the sciatic nerve. Now motor branches of the common fibular nerve. are the short head of biceps femoris directly. Also supplies muscles in the lateral and the anterior compartments of the leg. Sensory supply, it innervates the skin of the lateral leg and the dorsum of the foot. Okay. Now, as soon as the common peroneal nerve is formed, it divides into two branches: superficial peroneal nerve and the deep peroneal nerve. Now, let us talk about the superficial peroneal nerve. So, motor and the sensory branches of the superficial peroneal nerve are motor branches. It innervates the muscle in the lateral compartment of the leg. Okay, and the sensory supply of this nerve is is on the anterolateral aspect of the distal leg. As you can see in this diagram, this is the um superficial fibular nerve. Okay, and as it descends down, it it supplies anterolateral aspect of the distal leg and the majority of the dorsum of the foot, apart from the webbing between the hallux and the second digit. Okay, so as you can see in this portion, I don't know if you can see this, but this is it. I am marking it in black. Okay, so this portion is not supplied by the superficial peroneal nerve. Okay, now deep peroneal nerve. So the nerve root of the deep peroneal nerve are same as the sciatic nerve. Motor and sensory functions. Motor function, it innervates the muscles in the anterior compartment of the leg as well as some of the intrinsic muscles of the foot. And sensory function supplies the triangular region of the skin between the first and second toe. Okay, so this one, as you can see, this one. Okay, I sorry guys, just widespread. Okay, this whole portion of the leg of the foot between the first and the second toes is supplied by the peroneal nerve. Peroneal nerve. Okay. Now let us read the question once more. Third and fourth lumbricals, lateral two lumbricals of foot are supplied by which nerve? Guys, which nerve? Tell me. Hmm. So it is a lateral plantar nerve. Okay. So wait, I'll mark it. So this is a lateral plantar nerve. Okay. And this lateral plantar nerve is a branch of a tibial nerve. Tibial nerve is a branch of a sciatic nerve, and the sciatic nerve is a branch of a L4, L5, S1, S2, S3 nerve roots of the spinal cord. Okay.